Good morning, all. My name is Steve Maingot. I'm one of the co-chair of the UHC working group. And just a brief bio. I'm a health informatics specialist and governance, and I past chair a very large mental health charity in London that provided support pan-London. Using a number of models, just briefly mention one. You heard about culture sensitivity and stigma. There's a world-renowned Black French psychiatrist who mastered this. His name is Frantz Fanon, and that's one of the models that we use at my charity successfully. So there's empirical evidence that it works. I'm a member of the World Federation of Mental Health and a member of their secretariat. I bring you greetings from the World Federation Secretary General, Professor Gabriel Ebijaro. He sends his best wishes and hope all is well for the annual meeting. Just a brief overview of the UHC working group. Under the stewardship of Ali, we produced a concept note which intended to identify the key arcs on the mental health and UHC. The key target for the policymakers at the UN high-level meeting scheduled for this year: organization planning and preparing for the UN high-level meeting, UHC 23, WHO, UHC 2020, etc. But the key objectives is ensuring the mental health is meaningfully included in the road to and as part of the declaration at the UN HLM and UHC 2023. And second objective is providing a set of key arcs for the meaningful integration of mental health into UHC moving forward. Today's session focus on the purpose of the meeting is to learn on the latest developments in global, regional, and national mental health, pragmatic policy, and advocacy. So, our session is structured such. Participants are divided up and sent to breakout sessions to facilitate discussion. That will be 10 minutes. Or 20 minutes. Then there'll be, so that's discussion one. Discussion two, where you have a swap between participants, and that will be another 20 minutes. And then the final bit is feeding back general discussions and deciding priorities, and there are 30 minutes. So what I'm looking for in those discussions is for you to identify what are the key arcs? What are the key points that needs to be fed back and collated that sends the key messages that we want to be taken on board? Now, there are 3 breakout sessions. The breakout one lead is Shani, and the discussion theme is around successful models of integrating mental health into UHC, sharing of best practices, advocacy, resources, identification, and stakeholders. The second stream is led by Taha, and that's adopted an integrated approach, comorbidities between mental and physical health. The third breakout is led by Pradeep, and that's bringing UHC to the community, focused discussion on primary health care, community-based care, including involving communities and PWLEs in advocacy and policy. Now, some may spot that 1 and 3 seem similar. So for emphasis, 1 is focusing on advocacy in the main, and 3 is around policy. But it will touch on advocacy, but the focus is around policy. We're going to use this room and split into 3 parts. So the 3 breakout groups. And if may I ask Ali to assist in giving that direction.
Hi, everyone. Thank you so much for joining this session. So we've divided the room into 3 different breakout sessions. Breakout room 1 will be led by Shani GMHAN from South Africa. You can see her over here. She's going to be in this corner. Very soon, you're going to see her names up on the list on the main screen, so you'll be able to see which breakout discussion you're going to be a part of. Breakout 2 is going to be Taha Sabri over there from Pakistan, and breakout 3 is going to be led by Pradeep Gunaratne. With that, I think, Steve, is there anything else that you need to say, or shall we kickstart conversation?
Yes, we should get
Excellent.
Flip charts for you to capture it.
So we'll let the conversations begin. Please feel free to participate and make sure that you give your opinions, because your voices really, really matter. And we hope that you have a good experience. You can learn from each other and teach each other a whole lot of things. So thank you for signing up for the session, and let the breakouts begin.